Good morning, everyone. To my dearest panelist, Dr. Sarla Dulier, to Sir Robinel Alba, to Dr. Joaquim Sapol, to Sir Tony Ray Kanaman, and to my dear advisor, Dr. Jerry Able, and to our research coordinator, Dr. Hermie Burlado, a pleasant day. I am Mary Chris Castillo Jacinto, and this is my final defense entitled Hospital Information System Utilization and Caring Behavior Among Nurses in Private Hospital in Ross City. What is? Hospital information system are increasingly adopted in private hospital in the Philippines, including Ross City, to improve healthcare delivery and decision making. Despite this, there are limited evidence on how his usage directly affects nurses' caring behaviors. Muhammad Poor et al. 2021 noted that his implementation supports hospital operation but may be underutilized due to issues such as inadequate training or resistance to change. According to Takti et al. 2021, while his can provide timely and reliable information, some nurses do not fully integrate it into their clinical routines. This raises concerns about whether technological adoption translate into improvement, compassionate care, or adds complexity to nursing practice. What should be? Hospital information system should enhance, not hinder, the nurse's ability to provide compassionate and holistic care. Lee, 2006, emphasized that information system should empower nurses by giving access to real-time data, decision support tools, and evidence-based resource tools that, when used effectively, improve judgment and clinical care. In an ideal scenario, his helps streamline documentation and administrative tasks, allowing nurses to devote more attention to direct patient care, thus strengthening caring behavior, according to Tupas et al. 2013. Discrepancy. While his is available in private hospital, its impact on nurses' caring behavior remains unclear. There exists a discrepancy between the potential benefits of his and the observed quality of nurse patient interaction. The assumption that his improves care may not hold if nurses are not fully engaged or trained in its use. This research seeks to address the gap identified by Muhammad Poor et al. 2021 and Lee 2006, who highlighted the lack of integration between his utility and patient centered outcomes such as compassion, empathy, and caring behavior. For the objectives of the study, this study aims to determine if there is a relationship between utilization of the hospital information system, HIS, and caring behavior of among nurses in private hospital in Capiz. Specifically, this study aims to determine the level of utilization of the hospital information system among nurses, determine the level of caring behavior among nurses, and to determine if there is a significant relationship between the utilization of his and caring behavior among nurses. For the concept map, she can see hospital information system utilization, which is the independent variable, and caring behavior, the dependent variable. For the theoretical framework, this study anchored to data information knowledge and wisdom, the IKW model by Judith Graves and Sheila Corcoran, 1989. So the DIKW model shows how data becomes information, information becomes knowledge, and knowledge leads to wise decision. In nursing, this helps transform raw patient data into meaningful actions, guiding better care and clinical judgment. For the significance of the study, hospital information, a hospital administrator, this study will benefit hospital by reducing cost, by minimizing paperwork, enhancing safety, reducing duplicate testing, improving operational efficiency, and supporting hospital in achieving their business objective. For the nurse manager, this will serve as the basis to enable quick access to records, allowing for more coordinated, efficient care, and to develop their self efficacy and sense of responsibility to participate in the development of electronic health management system policy. For the nurse and nursing aid, information from this study will enhance the knowledge of nurses and nursing aides of the benefits of electronic health management system. It helps effectively diagnose patients, reduce medical errors, and provide safer, more holistic care. For the patients, the development and improvement of electronic health management system policies will directly affect the access, cost, and quality of the patient care. His policies can help it improves interaction and communication between patients and providers, enhancing the convenience of healthcare. The more healthcare providers participate in his policy making, the more patient will benefit from them. For the future researcher, the results of this study can serve as a valuable resource and reference for the future researchers in conducting the formulation and formulating their own research studies, especially those related to nurses in delivering holistic care service approach with the help of his scope of limitation. Inclusion criteria. So there are total of 166 bedside nurses working in selected private hospitals in Ross City. To qualify, the participant must meet the following criteria. For the employment status, actively employed as a bedside nurse in one of the selected hospitals. For the work experience, must have completed at least 1 year of service in the hospital. Consent, willing to provide informed consent to participate the study. For the age, must be between 21 to 59 years old. For the gender, open to both male and female nurses. The purpose is to determine the relationship between hospital information system utilization and caring behavior among nurses in private hospital in Capiz. Focus his usage and caring behavior of bedside nurses in Ross City private hospitals. The design quantitative research using descriptive correlational design. For the sampling, we use the stratified random sampling for fair representation. The nurse list source from HR departments. Collect data collection. This is the research made panel approved survey questionnaire. Timeline, which is February 2024 to May 2025, conducted exclusively in Ross City. For the methodology, research design, which is quantitative research using descriptive correlational design. The research instrument, a research made questionnaire validated by 3 experts, respondents, bedside nurses from selected private hospitals in Ross City. For the part 1, the demographic, which is the age group, gender, years of nursing experience, department, example ICU and ER, frequency of his use. For the part 2, caring behavior dependent variable, so we use 20 Likert scale items, 1 to 5 scale, focus area, which is the time management and patient interaction, quality of care, empathy and compassion, and efficiency and effectiveness. For the part 3, his utilization independent variables, we use the 20 Likert scale items, so 1 to 5 scale, focus areas, ease of use, workflow efficiency, patient care and safety, collaboration, and communication. Validity evaluated by three expert validators, reliability pilot testing with 30 non-participant nurses. We use the Crobox Alpha for 0.955 his utilization and 0.961 for the caring behavior. It indicates high internal consistency and reliability. For the ethical consideration, the permission, the distribution, and the collection. For the data collection, we have informed consent and submission to ethical review board. For the data processing and analysis, data gathering procedure, seek permission. I seek permission from selected private hospital in Raw City, submit research protocol to the Research Ethics Review Board or RERB for approval, obtain informed consent from participants ensuring they understand the study purpose, ensure confidentiality, data protection, and ethical compliance, use researcher-made validated survey questionnaire for data collection, gather data from bedside nurses using stratified sampling, organize data based on participants' responses. For the data processing procedure, maintain ethical standards and confidentiality throughout data handling. Use SPS or statistical package for social sciences for data organization and processing. Review and compare findings with relevant secondary sources such as published article. Avoid plagiarism and data fraud. Data analysis procedure. I use SPSS to ensure accurate and reliable analysis. Apply descriptive statistics, frequency, percentages, percentages, percentage, mean, and standard deviation. Use correlational analysis to examine the relationship between his utilization, nurses' caring behavior. Findings will be validated with secondary literature. The aim is to provide insights into how his impacts nursing care. For the result and discussion, presents demographics of respondents, his utilization, caring behavior, relationship between his use and caring behavior. So sa and demographic information, so we have the total of 115 respondent. Age majority 21 to 30 years old, 61 respondents, which is 53.0%. 30 to 40 years old or 45 respondents corresponds to 39.13%. 41 to 50 years old corresponds to 5 respondents, 4.35%. 51 to and above, 4 respondents, 3.48%. So the mean age is 36 years old. For the sex, female mostly, which is 89 respondents, the total of 77.39%, and the male is 26 respondents, which is 22.61%. There is no respondents identified as other. For the years of nursing experience, 1 to 3 years, which is the total of 55 respondents, 47.83%. 4.6 years, 23 respondents, which is 20%. 7 to 10 years, 19 respondents, 16.16%. 0.52%, 10 years and above, which is 18 years respondents, which is 15.65%. None had less than 1 year experience. Department assigned medical surgical ward, 27%, which composed of 23.48%. The emergency room, ER, has 23 respondents, which is 20%. ICU, 16 respondents, which is 13.91%. Operating room, 15, 13.04%. OB-GYN, 12, 10.43%. And pediatric, 10, 8.73%. We have the NICU, 7 respondents, which is 6.09%. And private rooms has 5 respondents, which is 4.35%. For the frequency of his use, always has 70 respondents, which is 60.87%. Frequently used, 21 respondents, which is 18.26%. And occasionally used, which has 9 respondents, 7.83%. Rarely, 15, 13.04%. For the objective, determine the level of utilization of the hospital information system among nurses. Findings: low utilization, less than 3.50, which has 33 respondents, total of 28.2%. Moderate utilization, which has 3.51 to 4.08, has 61 respondents, which has total of 52.1%. High utilization, more than 4.09, has 23 respondents. We have 19.7%. The conclusion: majority of nurses demonstrated moderate use of the hospital information system. Another objective, to determine the level of caring behavior among nurses. Findings: low impact, decrease in 3.50, which has 35 respondents, total of 29.9%. Moderate impact, ranging from 3.51 to 4.08, has 62 respondents, which is 53%. High impact, more than 4.09, has 20 respondents, 17.1%. The mean score is 3.71 moderate. Standard deviation is 0.61 and score range 2.10 to 5. Conclusion: most nurses perceive a moderate positive impact of his on caring behavior. Variability in responses reflects differences in access, training, and settings. Chow and Chan, 2012, his improved efficiency but may reduce emotional connection. Darwish et al., 2014, his helps with empathy and patient-centered decision. Kellick, 2025, his reduces admin work, increasing time for patient care. For the objective, determine if there is a significant relationship between utilization of his and caring behavior among nurses. The findings says low his used, which is less than 3.5. Total of 72.7% reported low perceived impact on caring behavior. No respondents reported high impact. Moderate his use, the ranges from 33.51 to 4.08, has 73.8% perceived moderate impact, shows consistent pattern between use and perception. High his use, more than 4.09, has 60.9% reported high impact on caring behavior. Correlation result, Spearman's rho, or is equals to 0.830, very strong positive correlational. P value is equals to 0.00, which is statistically significant. So in conclusion, increase his utilization is strongly linked to more positive perception of his impact on caring behavior. Supported by the study, Barshikar et al. And Sharifian et al., Hijau et al. Showing his both efficiency, decision making, and patient engagement. Major findings. Majority of the respondents, which is 53.04%, were aged 21 to 30 years old. And 77.39% were female, and they had 1 to 3 years nursing experience, which is 47.83%. They were mainly assigned to medical surgical ward, which is 23.48%, and emergency rooms, 20%. A majority 60.87% reported using his information system in their daily work. According to the result of this study, majority of the nurses, 52.1%, exhibit a moderate level of his utilization. Mean is equals to 3.79 and standard deviation of 0.58. His was generally perceived as user-friendly, time-saving, and supportive in improving efficiency and coordination. Most respondents, 53.0%, also reported a moderate perceived impact of his on their caring behavior. Mean is equals to 3.71 and standard deviation is equals to 0.61. His was seen as enhancing preparedness, efficiency, and responsiveness, though emotional connection and empathy aspects were perceived more moderately. A very strong positive correlation was found between his utilization and perceived impact on caring behavior using Spearman's rule, which is equals to 0.30, p is equals to 0.00. Higher levels of his use were associated with strong perception of caring and behavior support. Conclusion. Based on the indicative findings, the following conclusion were drawn. Nurses from private hospitals in Roa City generally demonstrate a moderate level of his utilization. This indicates a growing but constantly improving familiarity and comfort with the his. His is perceived as moderately supporting caring behavior by facilitating more efficient and informed care delivery. However, its influence on emotional and interpersonal aspects of patient care remains limited. There is a strong direct relationship between effective his use and positive perception of caring behavior, highlighting that technology can support, however, it should not replace the humanistic essence of nursing. To maximize his potential to enhance both technological and emotional dimensions of nursing care. Continuous training, system usability improvements, and supportive hospital policy are necessary. For the recommendation, for the hospital administrator, this should prioritize continuous investment and optimization of his, reduce admin costs, enhance safety, and streamline operations. Allocate resources for regular training on his, involve nurses in his design, feedback, and customization. Establish policies for integration, for full integration and usage of his across the organization. For the nurse manager, use his as the strategic tool to boost caring behavior. Lead in building a culture of accountability and self efficacy. Encourage nurses' role in policy formulation and his development. Ensure his reflects real world clinical needs. Nurses and nursing aides should engage in his training and development. Use his to improve accuracy and reduce error. Provide feedback for system improvement. Balance technology use with compassionate care. For patients, advocate for improve his policies, support systems that enhance communication and coordination, participate in healthcare feedback for better service delivery, nurse educators, integrate his use into the nursing curriculum, prepare prepare tech-savvy nurses to adopt in modern healthcare settings. Healthcare IT developers design user-friendly HIS that supports efficiency and empathy, promote policies that balance tech and compassionate care. For the future researcher, explore long-term effects of his on caring behavior, study his across diverse settings and outcomes, bridge gaps between system use and humanistic care. Thank you for listening.